Welcome back. We're here at the office of Sarah McClennen, and joining me now is Dr. Dan Bezon of Kearsarge Chiropractic. Thank you for joining us, Doctor.
Thank you for having me.
So you're a chiropractor. Tell us why someone might go see a chiropractor.
Well, traditionally it's usually thought of as with aches and pains and things of that nature. But as chiropractors, we deal with the entire body as a whole, with the central nervous system being the key to regulation. Okay. So we deal with the spine and the superstructure and other joints that are attached to that superstructure. And the brain passes messages down through the spinal column and then out to the organs. So in general, we just take care of the whole health of the body.
Right. If the spine is something wrong is there, your whole transport system, communication is all
That's correct.
not correct as well.
Probably the easiest way is just to think about a light bulb and a switch. We're dealing with a switch and the organs inside are the light bulbs. And or some people can relate to a car. You need to have good tires, you need to balance, front end alignment, sober driver. So I'm in charge of the alignment and also work on some of the soft tissue, but along with that, then the individual has to make sure that they're doing the right things, putting the right things into their bodies.
Okay, so you help with a lot of whole body work and advice along with your practice
Correct.
as well.
I'm also trying to determine what's caused the problems, maybe repetitive strain or accidents or job functions and things like that. So I'm trying to teach the individual how to get better by also correcting their own environment, maybe the way they sleep. And again, back to, we get nowadays so much repetitive problems with computers and things of this nature.
Interesting. So, I wouldn't think that would affect your spine, but I guess it does, the whole way you're sitting and using your hands, etc.
Yeah.
Okay. So typically, what does a first appointment look like for a client?
Well, on the first appointment, you come in and do just some initial paperwork and so forth, and then I just sit down just like we're doing here. I find out where the major problem is, and then I go through all the systems and also find out about maybe what medications and things that might be affecting you. Okay. And then we go from there into an exam, and then I explain what's going on. I work on the patient either manually or using a soft approach called activator. And then after that, I'll explain to you exactly what I did and what to expect, and then we go from there. Okay.
How many sessions would you say would be a good typical, first and initial round?
I've been in practice for over 35 years, and it's pretty much the same pattern. Within 12 to 15 visits, I usually have a person to the level that I'm going to be able to get them to. I mean, we can go longer. Some individuals are, maybe far less than that, depending on the degree of their problem. And then again, some are more, but I would say the average is somewhere between 12 to 15 visits.
Okay, so and would you recommend people come once a month, or is it once a week?
Well, at first I'll see them probably a couple times a week. In other words, in the initial phase, the body's got to get used to the change, and it's going to somewhat rebel against that because it's used to the old position. And so in a way, I'm training the body to accept the new position, and then as it accepts that, and then we widen the visits out, and then we get to a point where we'll go longer between the visits, and we'll see what works for them. Some patients come once a month, every 6 weeks, 8 weeks. Some people just come seasonally, with the changes. There's, with each season, it's got its own stress and strain.
Absolutely. Well, you brought some things to show us. Why don't you show us a little bit about the spine and how it works?
This is just a plastic replica of a spine.
Okay.
And we have the cervical, thoracic, lumbar spine, and this is the pelvic sections that makes up the pelvis and so forth here. The spine is designed to have these curves in the spine just like this.
I would thought it would be more straight.
If you look at you from behind or from the front, you want to be straight. This is maybe a better illustrator right here. When baby's born, just born with a C-curve, fits into the uterus, gets out through the birth canal.
Sure.
But any mother will tell you from getting banged in the chin, the first thing that baby does is start to work the curve into the neck, this being the front and the back, all right? This gives the baby the mechanical ability to hold its head up underneath the stress of gravity. Can't walk because it doesn't have this curve, but then right away you'll start seeing them on the bassinet, and as they're crawling, they're working this curve into the lower part of the spine, all right? Now this gives them mechanical ability to be able to stand up. And by having these curves in the spine, makes the spine 26 times stronger than if it was straight up and down.
Okay, right.
Many times in an accident, this will be injured in the neck, you'll lose this curve, and right away, these muscles have to work as hard as 8 times harder just to hold your head up.
You've lost some strength.
That's right. So that's some of the idea with chiropractic, trying to work some of these curves back into the spine.
Right.
And again, teaching the individual. We might do something like give them some exercises using a soft block like this, where they would lay across this at night as a simple exercise, working the curve in here.
Yeah.
So again, it has to do with education and what we're trying to teach you, if you're a patient, how to maintain your own spine and health.
Yeah, and it's a two-way street, and I like that. It's a conversation
That's
with
correct.
the patient and the practitioner. So great. Well, good. Well, I think the best way for our audience to get more information, we've got your phone number right up on the screen right now. Schedule that initial consultation and see what might be ailing them. Sounds like you've got some great therapies and a nice long-term care plan as well.
Okay.
So thank you very much for your time,
Thanks
Doctor.
for having me.
Take care.
Okay.
Check out more videos from the Kearsarge Chronicle here. And don't forget to click subscribe to keep up with everything going on in the Kearsarge Lake Sunapee region.